name is Hope Davis, and I am a kinesiology major at ULL with a concentration in health promotion and wellness. Today we're going to be discussing STDs. Trichomoniasis is the topic, or TRIC for short. I want you to think of all the STDs you have ever heard of and ask yourself why TRIC is not one of them. According to the CDC, or the Center for Disease Control and Prevention, TRIC is the most common curable STD, so it seems like we should have heard of it by now. Let's start at the beginning. What is the cause of trichomoniasis? Well, it isn't a viral STD like HIV and herpes, it's not a bacterial disease like chlamydia and syphilis, and it isn't fungal or an arthropod like crabs infection. No, trichomoniasis is a protozoan, also known as Trichomonas vaginalis, and it targets the urinary tract, vagina, digestive tract, and sometimes the prostate glands in men. The protozoan is pear-shaped parasite with a flagellate protein strands that whip around to aid in transportation, and they thrive inside the body where they eat the cells that they destroy. Trichomoniasis can be transmitted in two ways. The most common way is from person-to-person sexual contact, and rarely, but sometimes, TRIC can be picked up through moist surfaces, such as toilet seats, towels, pools, and saunas. If the genitals of an individual are in any way torn or raw, transmission of TRIC is much easier for the protozoan. TRIC can be spread from man to woman through penis to vagina intercourse or from women to women through vulva to vulva intercourse. While this disease tends to affect women in worse ways, men can also contract the disease. Men tend to be asymptomatic carriers, meaning they can pass the disease on to multiple partners and never even know that they had the disease in the first place. To prevent trichomoniasis via sexual contact, always practice safe sex using condoms. Not only can safe sex help reduce the risk of contracting any sexually transmitted disease, but it can also protect against any unplanned pregnancies. This may not be of your concern just yet, but women who get pregnant and were infected with trichomoniasis had adverse pregnancy outcomes such as premature births or infants with low birth weight due to the parasite weakening or rupturing the placental membrane. To prevent the disease from spreading further, you should limit the number of sexual partners and notify the partners immediately upon diagnosis. Symptoms will manifest more in females than males, but men can have symptoms as well. Symptoms in women may include painful intercourse, vaginal discharge, swelling, itching, or odor, as well as itching of the inner thighs. Symptoms in men could include burning after urination or ejaculation, or itching and discharge from the urethra. There is also the possibility of irritation of the prostate glands. As I mentioned earlier, TRIC is the most common curable STD. So the treatment plan is quite simple. This is where antibiotics come in. One dose is usually enough to knock out the disease, but any sexually active partners you have should also be treated for the disease even if they show no signs or symptoms. Chances are they have contracted the STD as well, and if they aren't treated at the same time, reinfection is imminent. Make sure to avoid any sexual contact until the treatment is finished so that you do not spread the disease further. Full recoveries are expected. TRIC comes in hot with an estimated 7.4 million cases annually in the United States, with 50 to 60% of those cases involving women. Yet only 30% of those people show any signs or symptoms at all. African American women are at the greatest risk for contracting the disease, followed by Mexican American women and then white women. To diagnose this STD, women should get a pelvic exam or see a doctor to have their vaginal discharge examined under a microscope to show signs of inflammation. Partners of women, such as males or other women, should also get checked and treated with antibiotics. Unlike many ruthless sexually transmitted diseases, trichomoniasis can be conquered with proper prevention and treatment protocols. Remember to always practice safe sex with condoms to limit skin-to-skin contact, and if you think you're experiencing symptoms, get checked immediately. Once you have been diagnosed, notify all sexual partners so that they can be treated as well to stop the spread of trichomoniasis for good.